Welcome back. Doctors are rejecting proposed annual statutory fee increases by the Health Professions Council of South Africa. The HPCSA has taken a decision to increase doctors and dentists' fees by 15% this year. But doctors say this is not a fair move given the pandemic. This week, the council met with organizations, including the South African Medical Association, to discuss the matter. Let's speak now to SAMA's Angelique Coetzee about what happened during the meeting. Ms. Coetzee, thank you very much for your time here on ENCA. Now, first of all, what happened during that meeting? I think it took place on Tuesday. Did everyone find each other?
Good morning. I'm so glad that you asked SAMA's opinion on this, on what happened, and transparent during that meeting on the 30th of March. So just to go one step back, SAMA became aware that the current Medical and Dental Board accepted the previous an increase of 28% by the previous board. We then, with SADA, the Dentist Association, wrote a letter to the HPCSA stating our unhappiness about this and asked them to bring this fee down. They then met and it was decided to have only a 15% increase. We were still unhappy about that, and the meeting that convened on the 30th of March, which SAMA with other role players attended. So according to the HPCSA, the increase was largely attributed to the professional conduct inquiries and related legal processes. That is quite it makes up about nearly 40% of their expenditure, but also, very important, their salaries is more than 50% of the whole HPCSA. So now what irritated SAMA and the other groups attending this meeting is the fact that there are 12 boards, of which the Medical and Dental Board is one board. And the other 11 boards had a 0% increase. So at this stage, only the doctors and the dentists had an increase of 15%. Although it's not a huge amount, it is 430 Rand increase, but it is not about the amount, it is about the principle of the matter. You cannot expect only the doctors and dentists to have an increase while all the other 11 has zero increase. Either everyone has got a zero increase or everyone contribute in equal measurements to this yearly fee. The other thing is what we have decided there is that from now on a yearly basis, so this year it needs to start around about December, that there will be a stakeholder engagement with the external parties before the HPCSA. And this is the council. This comes back to the council before they gazette any increases in our fees. SAMA had said long before already that the HPCSA is dysfunctional, and we have serious concerns, especially around the professional conduct inquiries that's been lodged against practitioners in the way that this is being funded. So it's about what is happening there, and then the salary increases. Also, SAMA said, and we had already a meeting with the Minister 2020, about the fact that we want an independent medical and dental board. We cannot, continue with the situation as it is currently. This was stated by the Majosi report that was conveyed under the previous Minister of Health, which showed that this is what needs to happen. And so far, it's 6 years later, nothing happened. But we will be pushing for that going forward.
Ms. Coetzee, these increments or increases are supposed to kick in, I think, on the 31st of May. So what do the doctors do in the meantime? Do they accept the 15% or are things still in negotiation stage?
So what we have said, or what we have come to an agreement in that during that meeting, is that they will go back and they will relook at the fees. So because this is a statutory fee, it's being gazetted at this stage, our members would need to pay their fees, especially if you're in a private sector. If you don't pay these fees, it means you're not registered with the HPCSA come 31st or the 1st of June. And technically, the Board of Healthcare funders and the medical schemes then don't need to pay you. So we don't expect that that will happen immediately if the doctors doesn't pay their fees. But if there's no increase in the fees and you have paid now this 15%, HPCSA made an undertaking that they will then credit you with the 430 Rand amount going forward. But we made it clear from SAMA's side that this was really the last time that this happens. We cannot accept this. We cannot accept to pay for dysfunctional organisation and expect the doctors and the dentists to foot this bill. The other thing is, even if you are in the public sector, if you do not pay your HPCSA fees by the 31st of May, come 1st of June, technically, you are then not employed anymore because that is one of the conditions of employment. So it is a bit of a problem. Again, we can enforce this and tell the members not to pay and call the bluff and see what is going to happen. But in the end of the day, it becomes a real nightmare with all of this. So the best way is to negotiate. We will also meet with the minister on this regard. But some are very clear, pay your dues. We are not happy with that. We made it clear this is the last time that this will happen from SAMA's side going forward.
All right. So when are you meeting with the Minister and perhaps the Health Professions Council of South Africa as well to try and come to an amicable solution before the 31st of May? Because I imagine if there are doctors who, for instance, have no way of paying that 15% increase, they're probably scared of being without a job by the 1st of June, especially because we've gone through so much in the past year financially as the entire globe.
So SAMA already wrote a letter to the minister last week asking for a meeting. We're now waiting for HPCSA to come back with whether they're going to bring down the fees or what are they going to do. Are they going to stay with the fees as it is? So we're waiting for them. We will give them a week to 10 days, especially now around the Easter weekend, to come back with a response to us. And then we will go back into negotiations around that. But it's the principle. It's about the principle of only increasing one board fee and not all 11. So if you had increased everyone, let's say, by 3%, it would have been, maybe they would have yielded a better income with that. But then only to choose one board. Yeah. In this case, doctors and the dentist, it's not fair. That is not transparent.